Hello, dear doctors, nurses, medical students, and health cut team. How are you today? I hope you are well, saving lives. Okay, here we are going to talk about another question of cardiology. A 44-year-old woman in the postnatal ward developed sudden onset chest pain and shortness of breath. She had an emergency C-section for fetal distress 2 days ago. She feels the breathlessness worsen when she lies down. She has a respiratory rate of 32 breaths per minute and a blood pressure of 100 on 60 mm Hg. Her oxygen saturation is 89% on room air and temperature is 36.9 degrees Celsius. The patient is not febrile. On examination, she looks pale and sweaty. Auscultation reveals widespread crepitations over both lung folds. It shows that the patient has pulmonary edema. An ECG was performed which shows sinus tachycardia. The patient's ECG is also normal. It shows that the patient has no MI. Oxygen by face mask was commenced. A chest X-ray confirms the diagnosis. Which single medication is used as part of the management? The answer is asking about medication. Okay. A. Co-amoxicillin. B. Aspirin. C. Furosemide. D. Low molecular weight heparin. E. Alteplase. Okay, the best choice can be furosemide. As we said, the patient had acute pulmonary edema and the patient is not febrile. Co-amoxicillin is not a good choice. Also, alteplase and low molecular weight heparin can be tricky because of the history of C-section. We can think about thromboembolism, but as the patient ECG is normal sinus rhythm and the patient is suffering from pulmonary edema, we can hear crepitation in the base of both legs. It shows that the patient has pulmonary edema and the best choice for treatment is furosemide. Here we are going to talk more about the choice. Okay, the patient is suffering from acute pulmonary edema brought upon by heart failure. It's worth noting that this stem is a little tricky as there were no risk factors of heart failure mentioned, and the information that the woman had a recent C-section makes physicians, especially if you have worked in an obstetric unit, think of pulmonary embolism. However, it's important to be aware that cardiac causes of breathlessness do occur in pregnancy and post-delivery as well. Okay. This stem gives the history of orthopnea, which clearly points towards heart failure as the reason of the shortness of breath. In terms of management for acute pulmonary edema, 4 important steps need to be done. First, sit patient up and give oxygen. Aim for saturation is about 95%, and in patients with COPD is about 90%. Glycerol trinitrate spray 2 puffs sublingual. And third, furosemide 40 mg intravenous slowly produces transient venodilation and subsequent diuresis. And fourth, diamorphine 2.5 to 5 mg intravenously slowly, or morphine 5 to 10 mg intravenous slowly can be used to relieve anxiety, pain, and the patient's distress. Here was a short explanation about the patient coming with heart failure because of pregnancy or after a C-section. For more information, we explained about the management of patients with acute pulmonary edema and heart failure in our other YouTube videos. You can watch them for more information. Thank you for your attention.